please don't hesitate to ask them. We'll try and get to them as quickly as possible. And then we will also be sending out today's webinar to all of our participants, as well as posting it on the website at healthcurrent.org and look for the EPCS Clip for Control campaign. Thank you again for joining us. Welcome, Connie.
Thank you, Christine. I'm excited today to here to talk to you about the written and electronically prescribed prescription requirements. I will be referring to the different mandates and issues throughout this presentation, so hopefully that will help you figure out where you need to be and what applies to you. This is the intent of this webinar. Very first of all, I would like to let you know that this campaign, our Click for Control campaign for 2019, we also did one in 2018, is a shared commitment. HealthCurrent has partnered with the Arizona Healthcare Cost Containment System, ACCESS, also the Arizona Department of Health Services and the Arizona Board of Pharmacy to manage and coordinate the statewide EPCS Click for Control campaign. The reason we did it is we understand that it's very difficult for many of the prescribers to even understand what they need to do. So we do a lot of things to help folks, and you'll see throughout this webinar how we can provide more help to you as well. For this webinar, for an overview, I'm going to be talking to you a little bit about Senate Bill 1001, which is affectionately known as the 2019 Opioid Epidemic Act, and also about House Bill 2075, which amended, updated, and removed and extended Senate Bill 1001. So that will be a lot of what we talk about today will be House Bill 2075, and wherever I can, I've indicated to you where the actual information that I'm presenting to you came from, via if it came from the House Bill or the Senate Bill. I'm also going to be talking about physician assistants, assistant medical practitioners, as well as pharmacist responsibilities. And I know we probably don't have a lot of pharmacists on the phone. However, much of what is the pharmacists are responsible for relates to prescribers, so I will be covering that as well. And as far as physician assistants are concerned, Senate Bill 1001 has some erroneous information in it about and requirements for physician assistants, which House Bill 2075 amended or corrected. So there's quite a bit of information about physician assistant in here. A little bit more that I'll talk about is permissible handwritten Schedule II opioid prescriptions and what's required for record keeping. I've gotten many telephone calls from folks about what am I supposed to do if my system is down? Well, today you're going to find out. I'm also going to talk a little bit about the Controlled Substance Prescription Monitoring Program. What's a mandate? What is mandated about it? And how do you access it? I'm also going to talk just a tiny bit about a great accomplishment that Arizona has made, and where the Arizona landscape, Arizona and national landscape are together, and how we compare to the national, and I'm pleased to say it's pretty good, so some excitement there. And also talk to you a little bit about some Click for Control resources that will help you with your journey through electronic prescribing of controlled substances. So let's talk about first physician assistant responsibilities. As I said before, House Bill 2075 corrected and clarified physician assistant issues that were in Senate Bill 1001. So let's talk about it. And as I said, I would tell you where, under what section, the specific information that I'm talking about on the slide can be found. And in this one, it's House Bill 2075, and as you can see on the bottom, it is Section 32, Area 2504. Some limits and requirements. Physician assistants need to be certified, and they can be certified for 30-day prescription periods for Schedule 2, 3, 4, and 5. that are opioids or benzodiazepine. Also, they can be certified for 90-day prescription privileges for Schedule 1, 2, 3, 4, and 5 controlled substances that are not opioids or benzodiazepine. Also, physician assistants must have either completed 45 hours of pharmacology or clinical management of drug therapy within the preceding 3 years of their licensing, or they can be certified by a national commission of physician assistants, and they must meet other requirements established by the board rule. And board rules are in the process of being developed. There's nothing exciting or anything you won't know about that's coming out, but it hasn't been defined, and it was not defined in House Bill 2075, so we're still waiting for that. Also, physician assistants shall not prescribe, dispense, or administer Schedule 2, 3, 4, and 5 controlled substances without delegation of a supervising physician. This complete slide and the next one speaks to supervising physician delegation requirements. As you can see here, the physician assistant must be board approved and have a USDA registration number. Prescription only, that's the non-controlled substance medications, cannot be prescribed without delegation by a supervising physician. And also, prescription medications intended to perform or induce an abortion may not be prescribed, dispensed, or administered by a physician assistant. Physician assistants also cannot prescribe, dispense, or administer more than 5 times in a 6-month period for each patient for Schedule 4 and 5 controlled substances. And also Schedule 3 controlled substances, that is an opioid or benzodiazepine, that is refillable without written, and that's the key here, the written consent of a supervising physician, and prescription-only drugs for a period exceeding 1 year. So a physician assistant cannot prescribe, dispense, or administer a prescription-only drug for longer than 1 year. Some more limits and requirements. All physician assistant prescriptions must contain your name, address, and phone number, and also your DEA registration number. A few more limits and requirements. A physician assistant must keep a log of all the Schedule 2 and 3 controlled substances that are administered or dispensed. And please see, take a look at the House Bill 2075, Section 2532 for emergency situations, MAT, that's medication administered treatment for drug dependencies, and dispensing guidelines and mandates. I didn't include everything in this presentation, or we'd be all here for 2-3 weeks. So I urge you to go out to the actual text of the bill and take a look at it. In a slide later on in this presentation, you will see where you can sign on. I've given you the links to sign into both the Senate bill and the House bill. So let's talk a little bit about pharmacist responsibilities. And I've included this, as I said in the beginning, because many of the pharmacy lists and limits and requirements also are of interest to prescribers. So as we all know, beginning January 1, 2020, Schedule 2 controlled substances may be dispensed only with an electronic prescription order. In other words, no more writing prescriptions. I get a lot of questions about, will there be a waiver process? What if I only do 2 or 3 controlled substance prescriptions in a year? Can't I get a waiver so I can just do that? And what I've been told is no one will be given a waiver that except in certain situations where it is noted, and I will tell you about a few of those in a moment. But just keep in mind, and please go ahead and get yourself moving on getting compliant, because I am told over and over by the powers that be, there will not be a waiver. You will not be able to prescribe if you aren't live on electronic prescribing system by January 1, 2020, and a pharmacist will not be able to dispense or fill a prescription after that date that is not electronically ordered. A prescription order, again, will not be filled, so please keep that in mind. Let's also look for a moment at what happens if what can be authorized verbally by a prescriber. So a pharmacist may correct any errors or omissions on written or electronic prescribing orders to the date, strength, dosage, and quantity of drugs, and directions for use. However, the pharmacist must document the changes made and the time and date the prescriber granted authorization to correct the original prescription order. And he must write it on the original handwritten order that he would write himself as he speaks on the phone verbally with the prescriber. This is probably a rare situation where this will happen if the system is down, or if he receives a written or e-prescribed, electronically prescribed order. He is allowed to change it under these circumstances and with these requirements. Pharmacist limits and requirements, again, not covered in this presentation. Prescription orders, I didn't include anything in compounded for direct administration to a patient. So I would urge you to either call me for some more information about it, or go ahead and look at the law itself. If you're going to call me about it, please take a look at the law itself first, and then call me about it, and I'll be happy to walk you through and help you as much as I can. Also, I didn't cover anything for long-term care facility residents, hospice, or hospice care program, and I didn't do anything with controlled substances directly dispensed to consumers. That's the type of thing that you have to sign the book at the pharmacist for certain kinds of medications, cold medications, for example. Also, I didn't cover anything for veterinarians for their prescribing and dispensing. Just a quick note about veterinarians. In the original Senate Bill 1001, veterinarians were also required to prescribe, and all of us that have pets know that a veterinarian rarely prescribes. They mostly dispense. So it was discovered after the bill, Senate Bill 101 came out, that something would need to be done, because very few of the veterinarian systems were able to handle the prescribing of controlled substances. So they have the state has required the Veterinarian Association to let them know when they feel like the software is sufficiently available that they can begin doing things electronically, prescribing. A few things about medical practitioner responsibilities. Same thing here. Beginning January 1, each prescription order must, for a Schedule II controlled substance, and this is exact wording, that is an opioid, must be transmitted electronically to the dispensing pharmacy. Once again, there will be no waiver. I'm told that is it. Whether you write 1 or 100, you will need to be able to electronically prescribe. So let's talk about some of the limits and requirements that medical practitioners have. Again, there's a limit of a 5-day supply following a surgical procedure, then not more than 14-day supply, except for oncology diagnosis and traumatic injuries, except for hospice, end-of-life, palliative, and or skilled nursing care. Any burn or MAT, that's the medication-administered treatment for opioid addiction disease, and also any infants that are being weaned off opioids. Other than those situations, only a 5-day supply can be prescribed. Now, I've combined together medical practitioners as well as pharmacist responsibilities because it kind of goes hand in hand, and I think it's important that both practitioners and pharmacists understand the requirements on both sides of the fence. Medical practitioners may write, and a pharmacist may dispense a written Schedule II controlled substance prescription order when their electronic prescribing system or the pharmacy management system is down. And I get that question all the time. What are we going to do if our system is down? You may handwrite it. The pharmacist and the medical practitioner must maintain a record of when the system was not operational or available. So you need to, if you're going to write, you need to be able to confirm and document that your system was down and not available. Prescription, also you can write any federal prescriptions, any prescription that will be dispensed in a federal facility. For example, prescriptions to a VA, a military base like Luke, health facilities, any of the IHS or Indian Health Services hospitals or other facilities, and any tribal-owned clinic patients you can write prescriptions for. Keep in mind, it's like federal. If you think about any federal facility, this is what this means. And again, just as a reminder, down on the bottom, I've given you where in House Bill 2075 you can find it. It is in Section 362525. Also, in emergency situations, the quantities of Schedule II controlled substances may be dispensed on oral orders or verbal orders of medical practitioners. However, if it's a verbal, the pharmacist must transcribe. In other words, they must write out the oral, whatever was given to them orally, so that it contains all the information except the medical practitioner's manual signature. So everything that would be included in a normal EPCS, electronically prescribed order, must be handwritten by the pharmacist, or could be typed, I suppose, but actually transcribed by the pharmacist. And then, within 7 days, the medical practitioner must deliver either written or electronically prepared order with signature to the dispensing pharmacist so they can keep the information together. I promised you that I would let you know about the Arizona, where we are and versus the national landscape. Where are we in our progress in getting everyone up and live? The good news is, according to SureScripts, which is a national company that prepares a national project progress report every year, they usually send it out in July of the year. So in July of 2019, we received the statistics from SureScripts for 2018, and the good news was that Arizona jumped from number 22 to 11th place, which was the largest rise in the country. And I contribute that basically to everyone understanding and wanting to get on board with being able to electronically prescribe and control substances. That's some very good news for us. I was very proud and very happy that we were able to do that. I put another slide in here, just a quick one, to let you have a little bit of eyesight on where all prescriptions were in 2016, 17, and 18. Same for non-controlled substances and then for controlled substances. This is for the nation, not for Arizona. But I thought you'd like to be able to see how we have gained in those past years, and hopefully how we will also progress in 2019. So how does Arizona compare for EPCS? This is some updated information that I was able to get based upon June data. Pharmacies that were EPCS enabled in the nation were at 96%. In Arizona, it's 99%, and I can tell you that that is almost 100% because that figure includes the federal pharmacies who are not required yet to EPCS, and it also includes a couple, very few mom and pops who are not able to receive electronic prescriptions, and also for some pharmacies in the rural areas of Arizona where they cannot get broadband. So basically, we are, I would say we're 100%. I don't think we're ever going to get beyond 99, but we can hope. Also, prescribers, EPCS enabled nationwide was at 37% back in June of 2019. Arizona was at 60%, which I think is just absolutely awesome. So virtually all Arizona pharmacies are enabled, and Arizona prescribers are 23% right now ahead of the national numbers. We were in April, we were at 25%, we dropped 2% because some other states are catching up with us. You know, other states have a mandate as well as we do to, at some point, to become live on EPCS. I also want to cover a little bit today about the controlled substance prescription monitoring program, because it is a mandate. As you can see on the bottom of this slide, beginning in October 16th of 2017, all Arizona prescribers were required to access the Arizona Controlled Substance Prescription Monitoring Program before they write an opioid prescription. We're not doing that, folks. We need to start doing it. It is against your license if you're not doing it, but we need to get better at doing it, and we've got some webinars. Those of you may have already been on. The last one we did was on the Controlled Substance Prescription Monitoring Program. What it is it's just a database of all the patient-specific prescriptions that were dispensed from a pharmacy are all on a data site on the Board of Pharmacy, and that's where you go to look at for your patient what has been prescribed, and that helps us, you know, get rid of doctor shopping, and it helps us decrease inappropriate prescribing and reduce all the controlled substances that are out there. So hopefully you all are doing it. It's simple to do, easy to do, and it's interesting to see what happens. You also can find if someone's using your DEA number this way, because if you look at a couple of your prescriptions, I've had some folks that have gone in and looked at people that, you know, their prescribing record, and have come back and said, these are not all mine. And some issues were discovered. I will say no more. Also, here's the link for which requires, this is the legislation. There's a link there for 362606. If you'd like to look up what the medical practitioner's licenses are under Title 22. Also, what it specifically says is requires reviewing the past 12 months of a patient's record before prescribing. And that's any opioid, benzodiazepine, there we go, controlled substance list for Schedule 2, 3, or 4. And exceptions to reviewing are described there as well. Medical residents may register using a hospital DEA number and appropriate suffix. Prescribers must register there. You have to register to be included or being able to use the CSPMP. It is not, it's free of charge. So get yourself registered if you're not. I've given you the link there to get to the Board of Pharmacy's website to be able to get to the PMP. There are 3 different ways that you can connect, if you are a prescriber, that you can connect to the PMP on the Board of Pharmacy website. You can access it directly through the Board of Pharmacy website, and I've given you the login there. And again, you see where it says login. It means you you can do this, you need to go to the Board of Pharmacy website and register so that you can go log in before you have a prescription to write. Also, you can access it through your health record. Many of the EHRs, the electronic health records, offer the option of having it go directly to, you can click a button and go directly to the PMP. Also, some of them are available that will bring the PMP information in to your EHR system and alert you that way. You also, if you are a member of Health Current for the HIE, the Health Information Exchange, you can access it and connect via the HIE portal. A little bit of information about the Click for Control campaign. We have a lot of resources available on our Health Current website. We have a page for electronic prescribing as well as electronic prescribing of controlled substance websites where you can register for the webinars as well. There are some fact sheets there to help you get started, questions that I get asked. If it's a new one, I put it out there with the answer. We also have out there our future and upcoming webinars and other kinds of presentations, copies of our past newsletters, articles, slides, and that's kind of important. If any of you ever need slides, few slides, I can give them to you. Just give me a buzz and I'll be glad to send them to you if you want to include those slides in a presentation at your staff meetings. I'm also available free of charge to come and present at any of your conferences, meetings, whatever you'd like. I can come and, present for 45 minutes if you'd like, or 15 minutes, whatever works best for you. And keep in mind, we also do phone-based assistance, and there's no charge for it, as well as email communication. I get probably 10 to 15 emails and or calls each day asking me questions about e-prescribing, so don't be afraid to call. Also on our site are some flyers that you might want to download and share with your prescribers. Here's a list of the upcoming webinars. Today's on October 2nd, we're going to present a repeat of practices in prescriber readiness. October 16th, we'll present on understanding the new EPCS mandates and regulations, which is a different take on it than we did today. We're going to repeat the Controlled Substance Prescription Monitoring Program webinar on October 30th, and we're also going to do another one of these on October 26th. Oops, I said that wrong. November 6th. There we go. It is November 20th?
Yes.
Okay.
I apologize. It has been changed, so we do need to update that slide.
Okay. Good. Thank you. Thank you, Christine. Some closing remarks. Rather than read this slide to you, I think you all know what it's going to do for you, but I wanted to give you a little bit of heads up on something that we've got going on behind the scenes here. We've been working with Dr. First, which is one of the larger e-prescribing software vendors in the country. They are the back end for a lot of the different EHR systems, e-prescribing of controlled substance modules. So we've been working with Dr. First to be able to provide some special pricing and implementation assistance for a mobile device, a standalone, and desktop options. So watch for announcements and informational webinars coming up in the very near future. I was hoping I was going to be able to include it in today's, but unfortunately we didn't get that far with doing the deal. But for those of you that I've been talking with about the mobile devices, that you can get your EPCS prescribing on your mobile phone, it's absolutely awesome for those of you that travel or do surgery centers, dentists who do extractions in different offices. It's the way to go. I also wanted to let you know that this webinar is presented just to educate and help you get your arms around the adoption, but I also encourage you to go and review and interpret the legislation and mandate yourself based upon your specific needs and situations. And that's all I have to say today. Some information here for you on how to contact us. I've also given you a little bit of information here about our Health Current Summit and Trade Show coming up very quickly. Please register, learn more, click on this button here. I hope it works, as I just downloaded this very quickly before. It's November 13th and 14th. We'd love to see you there. And also I've given you some additional resources, and this is how you can get to the Opioid Epidemic Act, which is the SB 1001, and also House Bill 2075, which updated it. So, Christine, do we have any questions?
We do, Connie. We have a two-part question. The first question is, I'm curious if the limits or requirements for NPs prescribing is the same as those of medical practitioners.
For the NPs is the same as medical practitioners.
Yeah.
Now, read it to me one more time, please.
Is the limits or requirements for NPs, nurse practitioners prescribing, is that the same of those as medical practitioners?
Not completely, because a physician assistant must have a authorizing prescriber, an authorizing surgeon, that authorizing. I can't think of what I want to call that person. They must have an authorizing person that they're working with. So that is not required of a prescriber, but it is required of the nurse practitioner. However, the limits are a little bit different, but very close. So I would encourage you to go out to House Bill 2075 and check it. However, if you want to call me, I will help you research it.
Okay, yeah, that was the second part of the question is there specific information that is pertinent to nurse practitioners that is listed in HB 2075?
Absolutely, and if you look at the bottom of the slides in the section of the webinar about where I was speaking about the physician assistants, you will see down at the bottom of each one of the slides, if you're still online, I'll hold it up here for you. Right here, as pharmacist, there we go. It's physician assistants limits and requirements is in House Bill 2075. It's in section 322532.
Okay.
But I will happy to help you if you call me.
Okay. And then someone did respond that nurse practitioners shouldn't need a supervising physician under this law. Is that, do you have any more information about that?
The only information I have is what's available in House Bill 2075, and it does require them to have a see if I can get back to where it is here. A supervising physician. They must have consent and guidance from a supervising physician. But you will find that information on House Bill 2075 in 322532. Now, I don't know the exact requirements for a physician assistant who may be operating a clinic on her own, his or her own alone. I don't know the answer to that, but again, if you call me, I will be happy to help you research it.
There was also an additional response that physician's assistants having a supervising physician and that a physician's information sends the prescription in. So I think there's a little bit of, depending on the practice, perhaps how their protocols are for sending in that controlled substance may vary. So if there needs to be a deeper dive, perhaps that one-on-one conversation would be helpful.
Yes, I totally agree. Thank you, Christine.
And the question did come up about registering for the 2019 Health Current Summit and Trade Show. If you visit our website at healthcurrent.org/events, or you can click on one of our sliders right on the home page, and that will take you to registration. We are bringing our agenda up as quickly as we can. So as soon as that is available, we will also be publishing that as well. At this time, I'm not seeing additional comments or questions that are being posed at this time. We can leave the line open for just a few more minutes. If there are others, please post your questions in the chat box. We'll be happy to answer them.
All right. Well, thank you, everyone, for participating, and please feel free to contact us if you need additional information or just need some help. Thank you very much.
Thank you again for participating in today's EPCS webinar. Again, this will be a recorded session available at our website, healthcurrent.org, and we will send out the slide deck to all of those who participated today. And again, if you have any questions, please contact Connie Hyde, our Program Director here at Health Current. Thank you very much. Have a wonderful day.